ZOLGENSMA, onasemnogene abeparvovec-xioi, is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into the vein. ZOLGENSMA was not evaluated in patients with advanced SMA. ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Please continue watching for additional important safety information.
My daughter, Tenley, is 4.5 years old. She has SMA type 1. When Tenley was born, she was 4 weeks early, and she didn't move a lot, but she didn't show any signs of serious illness. Then, at about a month old, she developed a wrist drop, and that's what really prompted us to go forward with seeing if there was anything else going on with her as far as her muscles or things like that. So then they started more testing and they did blood work. I got the call that the blood work came back and it was showing something genetic. He said, it's SMA type 1. He said he's seen it before and started explaining it to me. He also said, you just need to take her home and love her, call in hospice. You have maybe till she's 3. I just remember I was alone that day at her appointment because we didn't think she would be diagnosed that day, and especially with something terminal. I just felt very alone and just absolutely heartbroken. I just felt helpless, really, because this neurologist just told me that there was nothing I could do to save my child's life. For probably the first 3 days, we cried and just kind of were in mourning for the life that she was losing. But then something just came over me one day and I was like, no, I don't accept it and I'm going to find a way to help her. And so I went online and I actually started on Facebook, and on there I met someone who was in their upper 20s with SMA. She pointed me towards a hospital that offered the gene therapy clinical trial. I immediately got on the phone and tried to get Tenley an appointment to see if she qualified. The actual treatment was around 60 minutes and went through an IV. Diagnosis day was very disheartening, and treatment day was a chance that Tenley could get stronger, that she could live longer. So that day did and does mean a lot to us.
Patients will receive an oral corticosteroid and will need blood tests before and after infusion with ZOLGENSMA.
I'll always remember the day that Tenley received the one-time only dose for SMA. At the time of treatment, SMA had taken Tenley's ability to swallow thin liquids on her own. She was not able to move her legs very much at all. She was never able to hold her head up on her own. We didn't start noticing results right away. It came over time, but I would say within the first month, we could tell a difference in her strength and abilities. She started moving her legs more and started being able to hold her head up for short periods of time. When we found out Tenley was gaining strength, just as soon as we saw signs of that, we were just so grateful. Every little thing meant the world to us. Stopping the progression of SMA meant everything to us, because the further it progresses, the more muscle tone Tenley loses and abilities, and especially with breathing, eating on her own. Those are things that would eventually become fatal. Managing Tenley's SMA today is not as extensive as it could be, but we still take extra precautions. She has to have a feeding tube for extra nutritional support and to gain and maintain weight. She is on a BiPAP machine at night. We also do a cough assist machine and suction. This treatment has given Tenley opportunities. She is getting ready to celebrate her 5th birthday this year. And, that's really big milestone for someone with SMA type 1. Recently, she got her own wheelchair that she can move with her own hands, and so she's just loves to play hide and seek and chase her brother. She's able to really see her world in a different view than she has, and she's opening cabinets and, just exploring like a normal 4-year-old. Tenley was always raring to go, and she's been through so much, but she continues to smile, and she is truly the epitome of never give up and keep pressing forward. Tenley's never give up attitude definitely helps me to stay strong, and when I'm feeling weak, to keep pushing for her, because she has that willpower and that fight to live, and she deserves the best care.
Ask your child's doctor about the one-time infusion with ZOLGENSMA. Please continue watching for indication and important safety information. Indication. What is ZOLGENSMA? ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into a vein. ZOLGENSMA was not evaluated in patients with advanced SMA. Important safety information. What is the most important information I should know about ZOLGENSMA? ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Patients will receive an oral corticosteroid before and after infusion with ZOLGENSMA and will undergo regular blood tests to monitor liver function. Contact the patient's doctor immediately if the patient's skin and/or whites of the eyes appear yellowish, if the patient misses a dose of corticosteroid or vomits it up, or if the patient experiences a decrease in alertness. What should I watch for before, during, and after infusion with ZOLGENSMA? Infections before or after ZOLGENSMA infusion can lead to more serious complications. Caregivers and close contacts with the patient should follow infection prevention procedures. Contact the patient's doctor immediately if the patient experiences any signs of a possible infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Decreased platelet counts could occur following infusion with ZOLGENSMA. Seek immediate medical attention if the patient experiences unexpected bleeding or bruising. Thrombotic microangiopathy, TMA, has been reported to generally occur within the first 2 weeks after ZOLGENSMA infusion. Seek immediate medical attention if the patient experiences any signs or symptoms of TMA, such as unexpected bruising or bleeding, seizures, or decreased urine output. There is a theoretical risk of tumor development with gene therapies such as ZOLGENSMA. Contact the patient's doctor and Novartis Gene Therapies, Inc. at 1-833-828-3947 if a tumor develops. Infusion-related reactions may occur during and after ZOLGENSMA infusion. Seek immediate medical evaluation if signs and symptoms of infusion-related reaction occur, which may include rash, hives, vomiting, shortness of breath, respiratory symptoms, and/or changes in heart rate and blood pressure. What do I need to know about vaccinations and ZOLGENSMA? Talk with the patient's doctor to decide if adjustments to the vaccination schedule are needed to accommodate treatment with a corticosteroid. Protection against influenza and respiratory syncytial virus, RSV, is recommended, and vaccination status should be up to date prior to ZOLGENSMA administration. Please consult the patient's doctor. Do I need to take precautions with the patient's bodily waste? Temporarily, small amounts of ZOLGENSMA may be found in the patient's stool. Use good hand hygiene when coming into direct contact with patient body waste for 1 month after infusion with ZOLGENSMA. Disposable diapers should be sealed in disposable trash bags and thrown out with regular trash. What are the possible or likely side effects of ZOLGENSMA? The most common side effects that occurred in patients treated with ZOLGENSMA were elevated liver enzymes and vomiting. The safety information provided here is not comprehensive. Talk to the patient's doctor about any side effects that bother the patient or that don't go away. You are encouraged to report suspected side effects by contacting the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch, or Novartis Gene Therapies, Inc. at 1-833-828-3947. Please see the full prescribing information.